Hey, Dr. Neil Levin here, and I've been a chiropractor for 30 years. So if there's something I know about, it is pain. Hey, patients come in here all the time with neck pain and back pain and hips and sciatica and pain down the arm, and that's what I help them with. And when you want to talk about pain, you also want to talk about inflammation, because inflammation is an integral part of the entire process. If you have too much inflammation, you're going to be in pain. Now, inflammation is normal and healthy when it's appropriate. So let's say I fall and I hurt my knee, it needs to get inflamed to heal the injury. Let's say I get a bacterial infection or a viral infection. We want inflammation to help kill off those bacteria and virus and then get back to normal. And that's the key, getting back to normal. So what happens? The body creates these pro-resolving factors which actually quiet down the inflammatory event. When it's no longer needed, we want it to end. We don't want to be inflamed too long. That's how you end up with chronic pain. Now get this. The interesting part here is that your body literally makes its pro-resolving factors from omega-3s. That's like fish oil, krill oil, or eating fish. Now, if you don't have enough omega-3s, you're not going to be able to resolve an inflammatory event. So I always talk to my patients about taking fish oil or krill oil. Joy, have you heard me talk about this once or twice?
Every day.
So like if a patient has chronic pain or pain and they're not taking a fish oil or a krill oil and they're not eating fatty fish at least 3 times a week, I'm talking like tuna, salmon, sardines, which most people don't do, they literally are not going to be in a position to quiet down that inflammation, because again, your pro-resolving factors are made from omega-3s. So you can take a krill oil, you can take a fish oil, they're both great. I like the krill oil better, and the reason is it works faster. The omega-3s in krill oil are on phospholipids, which is exactly what your cell membranes are made out of. So it's like they have a fast pass, they get in the cells and they get to work fast, quieting down inflammation. So why wouldn't you take krill oil? Why would you take fish oil? Well, krill oil is more expensive. It works faster, but it's a little more. One famous study that I love, the folks with knee joint arthritis on krill oil got reduced pain in 28% in just 2 weeks and 38% in a month just by taking krill oil. And on top of that, the functionality of the knee improved. Their C-reactive protein went down nicely. That's a marker of inflammation on your blood work. So I love krill oil. The knock on krill oils is it's not as high in omega-3s, but Purity Products solves that with this product by infusing the krill oil with a high potency fish oil. So now another option is to just take a really good quality fish oil at a 2-to-1 ratio. So this is 600 EPA, 300 DHA, a 2-to-1 ratio. That's the most anti-inflammatory type of fish oil. It's less expensive. It's not going to work as quickly, but they're both fantastic. So if you're my patient, the next time you come in here, if you're not on an omega-3, let's talk about these, because it'll help you get better faster. And everybody knows, well, maybe not everybody, but what put omega-3s on the map is how beneficial they are for your cardiovascular health and your brain health, and literally the health of everything. If you're not my patient, you can get in touch by checking us out at drneillevin.com. Get in touch with us and we can talk about it. So if you're not on an omega-3, get on one, the most important nutrient you could possibly take.